My name's Scott Farley. I'm an orthopedic spine surgeon, and today I'd like to talk to you about a discogram. In this case, we're going to talk about a lumbar discogram. The purpose of a lumbar discogram is to give information about the health of the lumbar discs. And who this procedure is useful is trying to decide if the disc in the lower lumbar area is the source or major source of a patient's pain, and if it may or may not be beneficial to perform a lumbar fusion on a patient. So the idea is that when a patient is walking, his gravity, the disc that you can see between the bone and the disc and the bone is good in compression, meaning as a shock absorber, and it has a tough time in shear, forces going across the disc area. The disc can become degenerative, meaning wearing in time. The disc can be traumatically injured so that the back fibers, or the annulus, the outer fibers of the disc on this portion of the disc, can be injured, causing pain. And so if a disc has a discoloration or dehydration on an MRI on a T2 sequence, that would look like a very dark disc. If we operated on, in my practice, all patients who simply had a dark disc, we would do a lot of needless surgery for patients, and patients wouldn't get better. As a spine surgeon, I only want to do surgery in those patients that it's appropriate. I want to treat patients like they're family members of mine, and only do procedures such as a spinal fusion when I believe that the benefits significantly outweigh the risks. For some patients, as they've tried all treatment modalities, conservative options, pain management, injection procedures, and are still having significant pain, and that there is also corroborating or information from the MRI that would show a significantly altered or damaged disc. For these patients, I will talk to many of patients about performing a discogram, and the discogram is added information. A discogram is not the only bit of information that would use to decide if surgery is required, but is a very helpful adjunct to all of the other MRIs, X-rays, and history of a patient. And so to give you an idea of what the procedure entails, is a patient in a procedure room would have an IV placed and be twilighted, and be basically asleep, but conscious and breathing and controlling their own airway. And a patient would be laying on their stomach, and the pain doctor will be introducing a needle into the area of the disc that looks abnormal. So in this case, we'll say it'd be the L5-S1 disc is abnormal, and a needle would be placed into the L5-S1 disc, and then a needle would be placed into a control or a normal disc at L4, L5. Then, with the needle in place, which would be guided by an X-ray machine, a pressure transducer is placed, and so a transducer such as this would be placed onto the needle, and then through the transducer, dye would be placed into the actual disc. And what we would expect in the control level is it would produce very little pain for the patient who is asleep. They'd be conscious to say that is not my normal or my home pain. So it gives information about the patient's pain response to the pressure. It gives information about how the dye is able to collect in the disc, and it also gives a visual appearance of how the dye is distributed in the disc. Now again, the discogram is a procedure that's an adjunct to every other portion of a patient's care. All of their MRIs, all of their X-rays, their flexion extension X-rays, and helps with the possibility of determining if surgery is required or not required. In my training, when I was a resident, in my practice, this is an excellent procedure to gain information about you, the patient. And I find it a valuable tool when trying to help you guide your care.